One thing that wasn't in the governor's proposed budget was a recommendation to classify emergency medical services as an essential service. That classification would set up a state funding stream for local EMS agencies. The Idaho Department of Health and Welfare also didn't request that change in their budget. But that doesn't mean there aren't still needs. Producer Ruth Brown spent the last few months visiting with leaders of rural emergency medical services agencies about their ongoing struggles with funding.
If you break your leg or have a heart attack in rural Idaho, you would probably consider emergency medical services to be essential. But the state of Idaho disagrees, at least legally. Efforts in recent years to declare EMS an essential service have failed in the legislature, and that means the state isn't required to fund it. EMS availability varies widely, county by county, and relies heavily on local taxing districts and volunteers.
Our EMS system is a taxing district for Elmore County that provides the base core, and then the bulk of our revenue is with our medical billing.
Not every county has an EMS taxing district, and medical billing doesn't cover the full cost of having an ambulance respond. Many areas of the state still rely on volunteers, including Elmore County, which alone is more than 3,000 square miles. The size and population growth create some unique challenges for the agency.
We staff our populated areas with full-time staff, and then in our two mountainous areas, the Atlanta area, which is the northern part of the county, has a QRU, quick response unit up there, and then our prairie area up here is also kind of a remote area. It's a little tough to get to at times, and there's a really good roster of 12, 14 at any given time EMTs that are available up there as well. It's unique because we can cover any given day. We'll go from 3 medical calls to a car crash to a lost hiker with a broken leg in the mountains.
Despite being within that taxing district, the town of Prairie still relies on fundraisers for some of its emergency medical services.
Our building behind us is new. Last winter was the first time that we were able to house our vehicles in it. Otherwise, they've been sitting outside in the weather, and that, especially in the winter, causes problems. It's a response delay, having to sweep off the snow and get everything warmed up and hope your stuff isn't frozen. So our building has been made possible through volunteers and the donors and the sponsors that have made it all possible.
Resources aren't the only hassle. Finding volunteers is also a challenge for all EMS agencies.
We all have real jobs outside of what we do. So when we get a call, we're dispatched to the 911 Elmore County. We get a call, whatever we're doing, we stop and respond. That means we have to find childcare, we have to find someone to replace us at our jobs, or up and leave whatever we're doing. So finding people that are able to do that and make that kind of a commitment is always a challenge, especially as a volunteer agency.
Despite Moscow having a population of around 26,000 people and no ambulance taxing district, the city's fire and EMS services have one major benefit: the University of Idaho's students. All EMS services in Moscow are volunteer, and they require no taxpayer funding other than the administrative staff support.
We have residents that live in the fire stations, so in exchange they run a shift. We'll train them in structural firefighting and EMS, and they run a shift one day every 5. Some of them want to go on to structural firefighting or, a paid paramedic type fire-based job. Some of them want to go into medical school. Some just want to live here and play on a fire engine and support their community and run calls while they're getting a degree in something.
But there's a major problem with Moscow's system. The students usually leave town during the winter and summer breaks.
That is a significant chunk of our volunteers, is when they're gone. Our small cadre has to pick up the weight. The call volume's still here. The university town, the students bring some call volume to us, but most of the time it's the community that's calling. It's not necessarily campus. So just because the student population leaves, we still have lots of calls to cover.
There's also a lot of turnover.
The trade-off is we're in a constant training flux, because they are, if we're lucky to get them early in their college career and they stay, we can get 3 years out of them. They have to take the EMT class, which is 3 months, and then our onboarding and just getting them through the trainee process and making sure they have all the tools and know our town, because they're not from here. It's probably a good, if we're lucky, 6 months, but it's more like 9 months before they're fully independent.
Even if every county had an ambulance taxing district, it's up to the voters whether to support any tax increases, something that's proven difficult in many areas of the state.
You know, what's 5 and 10 years look like down the road? You know, we always talk about the biggest struggles for agencies is recruitment and retention. You know, how do we keep that? How do we keep good people? You know, how do we keep the burnout rate going? This is a very strenuous business. You know, we're responding to somebody's worst day, not their good days.
We have to pay to have people ready to respond. That's what some people don't understand, is the cost of readiness is what we're looking at.
It's still unclear if lawmakers will consider addressing EMS services in the legislative session and offer a new funding plan. And with so many freshman lawmakers, it isn't certain if a bill would pass.
We're not just talking about crisis to talk. We're truly, everyone's in dire straits. Paid, volunteer, everyone is struggling to meet the needs of their communities. We need to be deemed essential so that we have a starting place.